Good afternoon and welcome to our webinar, Switched On and Fired Up. With borders closed and the distance between Australia and Israel feeling even further than usual, we thank you for taking the time to join us and learn from three outstanding Israeli companies using AI to engage the workforce. A quick note on housekeeping. Q&A is available. And if you have any questions for our presenters, please send them via the Q&A button, not via the chat button. And please make note of which presenter your question is directed towards. If we do not have time to answer all of your questions today, we can answer them via an email that can be sent out after the webinar. By way of a short introduction, my name is Rachel Kaplan. I moved from Perth to Israel nearly 5 years ago. I'm proudly part of the Israel-Australia Chamber of Commerce, a non-profit organisation that promotes bilateral trade between Australia and Israel. In addition to webinars, we provide technology scouting and in-country support, helping companies outside Israel to access the local ecosystem. In 2019, I led a project that I'll never forget, hosting a delegation of top Australian executives, thinkers and leaders related to the built environment, property, construction, urban planning, etc. The delegation was co-led by two women that I've come to personally respect and admire deeply, Carol Schwartz and Kathryn Fagg. Kathryn is chairman of Boral and holds a number of top directorships, including NAB and CSIRO. An engineer by training, Kathryn has been recognized widely for her contribution even well beyond business for causes such as breast cancer research and women in science. Throughout the delegation, I was struck by Kathryn's questions and comments for each of the tech companies that we met, as she clearly not only observed their product, but also their character, team, and culture. While I hope that part of Kathryn kindly agreeing to moderate the webinar today is due to a significant experience with us here in Israel last year, there's no doubt that she is a leader who knows that motivated, supported, and engaged people are the beating heart of every organization. Kathryn, we sincerely thank you for a precious hour of your time today, and I hand over to you to lead the discussion with each of our presenters on how AI can be used to engage the workforce. Over to you, Kathryn.
Thank you, Rachel. It's so lovely to be with you again after meeting you in Israel last year, after my good friend Carol Schwartz did such a good job of encouraging me to visit and to co-lead the study tour. And it was a revelation to me. As Rachel said, I'm originally an engineer, so I like technology, but going to Israel and just seeing the innovation ecosystem there, as I said, was a revelation. And I was particularly intrigued by AI and just how obvious it was and is that AI is going to make such a profound difference to the world in which we live and the way we work and engage with other people. So I'm absolutely thrilled to be moderating this session this afternoon. And in fact, I've always been really interested on the people side of organisations as well as an engineering degree. I've actually got a master's degree in organisation behaviour. So it's always been a real passion of mine of how do people and organisations work. So we're going to hear today from three leading companies who are providing services that make a difference in terms of the way organisations can engage with their people. And if ever there was a time that it has been really obvious that engaging with our people is important, it's been over the last 6 months. And I know I'm based in Melbourne, so I'm here in lockdown. Obviously, our friends in Israel in lockdown. So we're sharing a very unusual human experience at the moment, but a great opportunity to obviously learn. And so let me introduce our very first company today, and that is Centrical, and we're very fortunate to be joined by the CEO, Djerriwarrh. And let me tell you a little bit about Centrical. So it's an AI-powered employee performance management company, which guides frontline employees, such as sales and contact centres, to success and growth, using real-time employees' performance management data, encouraging micro-learning, gamification, and coaching. Market leaders such as Microsoft, Novartis, Verizon, Optus, IAG, Office Depot, BMW, and Unilever use Centrical to improve their results. Over to you, Gal.
Hi, thank you, and thank you for the honor to be here. First, I have family in Australia, in Perth, so and also investor that is part of this this meeting. First, Centrical started after 25 years of experience in the field of BI analytics and big data. And I realized that if you help managers just to see their data, see their information and so on, it won't be enough. It should be around the employees. How can we create an actionable experience that will help sales and service employees to be aligned, to learn and grow, and to be engaged to what they need to do in the company? So this is actually Centrical. So we put the employee at the center of business success. Since then, we brought many customers, mainly large enterprise organizations from the fields of finance, telecommunication, BPOs, big performance organizations, business process outsourcers, and other large companies. We also have presence in Australia with companies like IACC, Optus, and other companies. So basically, we realized that there is a huge problem in the workplace. The main problem is that the employees are not engaged. Definitely employees that are in the field of sales and service. Most of them are not meeting their quotas, and those are like real numbers. So usually in large sales teams, you have the top 20, 30 people that brings most of the revenue. And the same thing happens with service organizations. The second thing is that people don't like to learn. They look at learning as a chore. They remember their universities. So there are courses. You learn for hours things that you will not use tomorrow. And the third aspect is around engagement. During COVID, something happened, right? The world learned that you can send employees to work from home, but there are effects, side effects, isolation, confusion. Once you could raise your hand and your manager came and helped you. Today it's not there, so the new normal of working from home, working from office, working from anywhere is actually there. So what we try to do is actually to put a focus on the employee and to put the employee at the center of every business practice. The first one is around performance. So we clarify to the employee, like in fitness tracker, what are your goals? And by the way, it could be personal goals. My goals and your goals could be different based on our experience, based on our seniority, based on our previous performance and success and knowledge. Second, it can change over time. I could sell 10 units of the Galaxy Note 10, so I'm liable to sell the upsell and cross-selling proposal. If I didn't, I will need reinforcement. So the goal should be dynamically adjust and personalize, again, using AI. I would like you also to remember only one term, new term, which is augmented people intelligence. You know, when you try to use AI, you think that the machine should be perfect. It should cover everything, all the aspects around the case. It's very hard. It can take years and decades to reach to this level. But if you create an augmented people intelligence, which means that you combine the AI together with the people intelligence, whether it's your employee, your manager, and so on, you reach to a perfect balance between the AI that brings, triggers, cases, and so on, and the employees or the managers that can bring creativity. They can bring out-of-the-box solutions, holistic solutions that sometimes the parameters are not in the process. So the first aspect is performance. The second is learning, and learning is very highly dependent on AI because, again, it's heavily personalized based on your knowledge gaps and performance gaps. So every individual will learn just in time what they need to learn in order to improve their current performance based on your gaps. For example, if you didn't sell the Note 20, I'll train you how to sell the Note 20 and not how to do other things. The third aspect would be around engagement. Engagement, and definitely in this period, is super important. How can you motivate your employees when you don't see them? How can you motivate your employees when they are in grinding experience of serving customers, selling to customers, keep receiving the no, thank you, no, thank you, and keep going? So using gamification elements of, game mechanisms that you use in a real performance in a real business environment, like friendly competitions, team competitions together, challenges, elements of kudos, hey, thank you, and so on. So you're able to create recognition and public rewarding by people, for people, and by managers for their employees. The second layer would be the interaction between the employee and her manager. The manager usually will get triggers from the AI and will focus, instead of all the employees, only on 2 or 3 employees with their specific problems. And this is augmented human intelligence or people intelligence, because they don't need to receive the whole solution, but just the relevant trigger. And then the manager that knows her employee will understand that, okay, I understand that there is a problem. It might be more complicated than what the data shows, and I will have the solution. And then the AI will take over again and will monitor the coaching program that the manager will set and will agree with the employee. So basically, we cover the employee, we help them succeed, we create a full cycle of improvement, both for the employee and her data, and also for the employee and her manager, and also, of course, the team. Now, it's not just engagement, improvement in engagement. We show tangible numbers, tangible KPIs of improvement, from improvement in revenue, improvement in customer satisfaction, improvement in employee attrition or retention, sorry. And almost every aspect of the business, we have tangible improvements, and you can see it from those numbers. The last slide, because we have very limited time. During COVID, Centrical grew by 6 times. We have 6 times more learning activities completed, 6 times more user activities that have been done in the system. And it's because everyone understands that, okay, it's easy to send employees with a modem, with a laptop, to work from home and give them Zoom and so on. But how can you align? How can you engage? How can you train? How can you manage? How can you reskill? The airlines are going down, but you have maybe other companies that you need to focus. So you need to reskill your employees that handle airlines before. So the organization started to be much more flexible and agile, and we help them using AI and real-time employee performance management. So I'll hope to receive many questions during the panel, and thank you.
Thanks, Gal. And just a reminder to everyone, if you would like to ask a question, just do it through the Q&A on your screen. Thanks, Gal. And I'm really pleased to introduce our second speaker for today, who is Raj Sundaresan, who is the Regional Vice President for APAC for WalkMe. And he will be telling us more about the company, but they created a digital adoption platform, which is to simplify the use of technology. And they do this by leveraging guidance, engagement, automation, and AI to design user journeys across applications. In this way, WalkMe can augment the technology to become more human-like, so it's easier to use. It's a unicorn valued at over $1 billion, and WalkMe currently serves over 2,000 enterprises globally, including more than 150 in Australia and New Zealand. And they've got a 40-person full-service team onshore here between Sydney and Melbourne. Over to you, Raj, who is actually in Singapore.
Thank you very much, Kathryn, and thank you to the Israeli Chamber for the opportunity to share a little bit about our story. WalkMe was founded about 8 years ago because of a mother's desire to engage better with technology. Our founder's mother wanted to do an online banking transaction, didn't know how to do it, and so she called her son. And our founder basically walked his mum through that experience over the phone. Mum, click here, 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 and here. Fast forward 2 weeks, mum called again. Fast forward another 2 weeks, mum called again. And at that point, our founder thought maybe there are just a few other mums and dads out there who could use some in-application guidance to execute on technology. And that's how we were born. Now, when we start thinking about the problem we're trying to solve, really it stems from this notion of digital transformation. And digital transformations obviously hold great promise. That's why every organization on the planet is really thinking how they leverage digital as they transform their business. In a lot of cases, the promise is really about how we can drive employee productivity and customer efficiency, so much so that they actually have an impact on a P&L. What's interesting around the outcome organizations are looking are the problems that it's confronted with. So the slide on the left, highlighted as A, tracks the amount of software that's been sold over the last 30, 40 years. And as you can see, there's an exponential spend, so much so that software spend is over $600 billion today. If you layer services on top of that, that's now closer to $3 trillion in an ecosystem. And that's larger than the GDP of Australia. Of Italy. Now, if you then think that that software is going to have an impact on productivity, what became alarming was that over the last 10 years, what we've seen is actually productivity effectively flatten out in places like America. So what is it really saying to us? Well, what it's saying is the yin and the yang, that is software together with productivity, can only deliver on the value when people are actually using the software in context of their job. And this is what digital adoption is called. So when you think about this notion of digital adoption, I like to start at basic principles. You know, it is around the notion of to adopt. And when you think about to adopt something, it's really a conscious action to choose to take up or use something in a consistent manner. Now, when we think about this in the digital world, we're really now thinking about how can we get the technology, not the human, but the technology to engage with the user, to help the user execute, not learn, not read, not study, but to execute on digital processes. So when you think about what we're talking about, can we create a similar type of experience that we had with the humble GPS, like Waze and Google Maps, where you punch in where you want to go and the technology drives the behavior? And why is that important? Well, it's important because of the human condition. The human condition is such that we all understand that we all have a learning curve, but we struggle with this notion of a forgetting curve. And you know, this time next week, hopefully not all of you, but some of you would have forgotten close to 70% of what I've shared. Maybe because I'm not such a good presenter, but I think that forgetting curve also plays a part. Now, as you go through that journey, you then spend a lot of time trying to retrain people, right? Only for things in the new cloud world to change several months down the track, and then you start that journey all over again. And so we think existing adoption strategies are simply outdated. We did some math around this, and this is where the AI and the science comes into it. And earlier this year, off the basis of 750 million people using our platform, we were able to pull together interactions, 800 billion events, and we learned the following things. On average, people are spending 6.5 minutes on a web form. On average, they need 3 web forms to complete a process. So do the math, that's about 20 minutes. We're seeing exponential error rates in systems, so data quality is actually pretty poor. And what we're starting to learn with the help of the science and the AI is that if your processes are in excess of 2 minutes, you start seeing great fallouts of people abandoning processes. In fact, the most reliable data point is that if your process is about 70 seconds, you've got a really good chance in people completing that end-to-end process. And if you build a bit of automation in that, the execution rates skyrocket to as high as 65%. Finally, some of the AI is telling us, some of the science is telling us that over half of people don't necessarily need help at the start of the journey, but along the continuum of that journey. And so when you think about that, it's incredible when those design principles are not put into use, then these types of statistics that you see on the right side of the screen come to life. And it's quite scary when you start thinking that transformation programs typically don't yield the value they once promised. And that's because they haven't put the user in the center of what they're trying to do. And more importantly, they haven't thought about different user journeys at different stages of that digital journey, be it pre-implementation, during system onboarding, just-in-time help, when new functional releases are pushed out, and when you start thinking about your real problematic processes on how you can refine them to move forward. I thought I'd throw in this slide because this is the latest from the research that we've had. And this is really around the new normal employee. And with the new normal employee working from home, we thought it'd be useful to try and understand what that support adoption looked like in the context of these employees. And this is off a rather small sample size of about 13,000 people. But what we're starting to see is people, users, employees require different types of intervention events to help them get through their day, whether it's guidance through an application, whether it's validation around a field, whether it's pulling new knowledge bases, or if it's searching for more information. And a typical employee will engage in this manner around 13 different types of transactions. So how does it work? Very simply, it's an overlay technology that sits on top of any technology, where at first we collect data to understand and analyze the obstacles that you're having. We then build out contextual guidance, which, like a simple GPS. We then try and understand, based on AI-driven rules, where you may need some proactive engagement. And then finally, where we see the ability to automate, we will. And then the cycle starts again, where we run the analytics. So this continuous process improvement takes place. Now, it's been a privilege sharing a little bit around WalkMe. I had the privilege of building out the Asia Pacific strategy. And 3 years ago, we had 6 people in Australia. Today, we have over 40. And we're very proud of the logos that represent Australia today. And I look forward to having an opportunity to answer some of your questions later on today. Thank you very much for your time, and I look forward to your questions. Kathryn, back to you.
Thanks a lot, Raj. And I'm now going to hand over to Ron Hoffman, who is here in Melbourne as well, and he's with XR Health. And just a little bit about their background. XR Health is TGA, so Therapeutic Goods Administration, registered virtual reality medical device company and telehealth provider that offers corporate wellness packages in physiotherapy, occupational therapy, and mental health. XR Health helps employees return to work faster and better with a virtual reality-based care plan that allows real-time visibility and reporting into employee engagement and clinical progress. XR Health operates in Israel, the US, and Australia. Here is a Bupa First provider and with 50 Australian team members, aiming to disrupt the allied health space. Over to you, Ron.
All right, thanks for that, Kathryn. And thank you very much for the IACC for the opportunity to talk with this forum. So we are XR Health, and it's a pleasure being here. My name is Ron, I'm part of the team, and we would love to be your corporate wellness partners. What is XR Health, and how is that related to HR technology? So we'll get to that, I hope, by the end of my 5 minutes. We are an Israeli startup. Today we are headquartered out of Boston in the USA. R&D team is still in Israel. We have clinics in Israel, in the USA, and now in Australia. We are the first company in the world to be an FDA-registered VR, virtual reality, medical device company. Today also a TGA-registered medical device company. We develop our own VR applications, which each one in turn is a medical device by itself. And we are also a telehealth provider here in Australia, a Bupa member's first clinic, as was mentioned. We cater for allied health care streams such as physiotherapy, occupational therapy, mental health, cognitive assessments, and others. So we are both a medical device company and a VR telehealth provider. Let's let the video explain in a minute and a half what it is that we're doing.
It's a fact that your health dictates your life, so it's time to put your treatment in great hands. Welcome to XR Health, a virtual reality telehealth clinic. You can now get professional physiotherapy treatments right from the comfort of your own home. Meet with your XR Health qualified physiotherapist online. Discuss your symptoms and begin your treatment journey. Your treatment will use a state-of-the-art virtual reality system, which will be sent right to your door. Welcome to the future of healthcare. Our patients tell us that they have enjoyed the experience of combining telehealth with our VR technology, making their treatment fun and interactive. We use virtual reality to guide your customized treatment plan in a simple and practical way. VR makes your treatment fun and engaging, while at the same time sending valuable data to your physiotherapist. You can even track your progress on our dashboard. XR Health. Experience, analyze, get better.
All right. So why VR? Why virtual reality? Virtual reality helps us tackle challenges within the allied health space. And 3 things I would love for you guys to take away from this conversation. Virtual reality, because from a patient perspective, we gamification of the treatment plans. It means that our patients, our users are having fun doing their care plan. When was the last time you guys had fun doing physiotherapy? I never had fun. And in turn, that creates engagement. But at the end of the day, it's all about data. And the virtual reality platform allows us, for the first time in allied health, in the world of allied health, to capture objective data. We control the virtual reality environment. The only variable is the user, is you, is the patient. And we can quantify the interaction between that user and the environment. And that allows us to capture a lot of data, valuable clinical data that allows our clinicians to have real-time visibility into the actual clinical progress of the care plan, to fine-tune the care plan to the specific you, to the specific patient, which in turn allows us to get the employee back to work sooner and with better health outcomes. It's also, and that's where it's very much relevant for corporates and HR functions, the data allows us visibility into the engagement, and which allows you guys to measure compliance of your team members with the care plans that you are paying for, so they can get back to work, to make sure that they are compliant with those care plans. So VR, virtual reality, allows us engagement, data, and compliance. Not going to go into a lot of details here, but XR Health is taking care of the entire logistical cycle, from sending the headsets to the patient for the duration of his care plan, and then receiving it back at our logistics center, managing all the corona, sterilization processes, software updates, etc., etc. We manage the entire logistical chain. We think that we can be your corporate wellness partner. We think that the virtual reality element of our technology provides unique value proposition for both your employees, but also to the organizations themselves. We can get your employees back to work faster and better. We can provide you, the HR function, the corporate, actual engagement visibility to make sure that your team members are complying with the care plans that you need them to go through. Everything we're saying is evidence-based. We are a medical device company, therefore we have clinical trials that are backing all of our clinical statements. At the moment in Australia, we're offering physiotherapy care plans and programs, but also mental health. We're in the process of introducing mental health, specifically around stress and burnout, which is very relevant, especially today in the corporate space. And I think that's it. I'll be happy to take your questions.
Thanks a lot, Ron. And just a reminder, everyone, if you do want to ask a question, please do put them into the Q&A. But Gal, can I come back to you just to kick off with some questions? And can you talk through with us what you saw has changed over the last 6 months in terms of employee engagement, and what you've specifically been able to see through your services?
So the question was for me?
Yeah, it was, Gal. Thank you.
Okay, can you please repeat? I was, yeah.
No, that's fine. Let me just say that again. So, Gal, I was really interested if you could just talk through what you've learned as a company over the last 6 months with COVID-19, given how people are operating differently now. What has it meant? What are you seeing, and what do you think the lessons are?
Yeah. So first, the company is around 6 years old, and we learned in the last 6 months more than anything in the previous 6 years. And also the usage grew by 6 times, which means that, if we had like a few 100,000 monthly learning activities completed, now we have a few millions, right? So basically, we saw that employees need to be interacted mainly in a humane approach. I can give you a few examples. The first one is like, are you familiar with your goals for this week? Please specify them. Do you have all the tools? Do you need help? And so on. So interaction around the employee ability to perform better, to understand, to be in alignment to the company goals, and to learn and to understand what's relevant now is very important. A second example was, and I really like it because Verizon, right, they closed the stores because of the pandemic. And one idea for a retailer with 1,000 stores was, let's try to sell from the curbsides, not from the storefront, but from the curbside. So in 24 hours, they put all the playbooks. What are the products that need to be sold? What are the new goals? What are the new targets? And so on. 24 hours, 1,000 stores, 8,000 employees started to sell from the curbsides. Business transformation in 24 hours done by our system the results were that Q2 and Q3 were their best ever, also better than the previous year because they were the only one open. So this like huge business transformation together with AI, performance engagement, new playbooks, and so on during COVID.
Thanks, Gal. And I'm sure some other people will be interested talking about COVID, so we'll come to those. But I'm going to jump to Ron now because we've got some questions coming in from Elaine, and I hope I'm pronouncing that name correctly. But interested, particularly thinking about physiotherapy services, whether you can use the product with your own physio, and then that second question around privacy of the health data of the employee, and is it visible to the corporate or not?
Yeah, sure. So the first question is no. At the moment, it's our own clinicians that are using the technology, and we're not offering, a business-to-business model where we license the technology. And that's because of lessons learned. If it's not our team members, then the quality of usage of the technology is not what we want it to be. And to Elaine's question, which is a very good question, by the way, and an important one, right? So first of all, XR Health in Australia abides by, medical privacy, patient privacy information, and there's two types of dashboards, right? That our platform allows. So there's the clinical dashboard, and that's only visible to the clinician, okay? Maybe also to a referring GP, but only to clinical professionals, okay? That's not, and that includes, what's my range of motion, how did I do in terms of jerkiness and smoothness of motion and other, clinical metrics that are very important from a clinical care plan point of view and make a lot of sense for clinicians and are covered by patient privacy. By the way, all our data is Australian sovereign stored, okay? Now, there's another element to our data, which is the engagement data, and that is de-identified from, so you don't see it's wrong, okay? But you can then have visibility into your population of employees to the individual ones, right? If they're doing and are they following through with a care plan that you guys have invested good money into to get them back to work or not, okay? And to correlate between, a specific de-identified patient and a specific employee will happen through the XR Health clinic unless we have, employee consent and we can make it identified data, but it's not clinical data, okay? It's just how often is he using the VR? How many VR sessions is he doing? When was the last time he touched VR? How long is he spending in each application? So it's not really information that's governed by patient privacy. So I hope that answers the question.
Thanks, Ron. I'm sure you have. Raj, could I come to you? And there's some more questions coming through. But Raj, I'm really interested when you've talked about digital adoption here. Can you just talk about the economics of it and how do companies look at it and whether it makes sense or not?
No, thanks for the question. And I think it's really important because when we go through transformation programs, I think it's really hard to measure the value realization and the benefits. And so what we've done is we've built out a framework that allows us to start thinking about where we want to end up. So I'll give you an example. Most people say, hey, I want to do this transformation program because I want to improve employee engagement within the organization. Great, but how do you know you have? And so when we start building content around user journeys, what we now do is we end it with a little survey. When we talk about a survey, was that good? Thumbs up, thumbs down, right? So you're pulse checking, you're nudging people every step of the way to figure out whether, that part of the transformation program is actually a positive experience for the employee. And I think it's very important that as organizations start on transformation journeys, they're trying to understand what they're trying to measure at that point in the journey. And note the word journey, because most transformation programs are not a destination unto themselves. They are journeys, and they are continuous journeys for a multitude of reasons. But the number one reason why they are journeys is because of the digital IQ of the end user. So when you start thinking about the economics, think about what you're trying to do. Are you like Walmart in the US trying to defer compliance fines because you haven't been able to produce a payroll stub that's accurate because your end employee doesn't have the right zip code in their core HR system, because that drives tax calculation? Are you an employer in Australia who's concerned about their employee next of kin details, which may not be in the repository? And how do you proactively engage with a user outside to drive that outcome? So the theme here really is to think about what outcome you're trying to achieve, how you can measure it, build the content around it, and then go from there.
Rachel asked me to answer a question. So the question was if COVID represents what will happen after with the employees, employee engagement and so on. And I think that COVID actually accelerated everything that we were talking about. But by the way, both us and also WalkMe, I think we experienced the same phenomena. I'm talking a lot with Rafi about that. So, we forecasted that in 2, 3, 4 years, the employee would be much more accountable to their performance. There is like the micro, the gig economy, right? Where everybody can be actually rewarded based on their actual impact, right? They do more code, they sell more and so on. It's easier to measure, it's easier to reward. It would be easier to train and to engage and so on. The problem was that the managers say, yeah, but we, something is working for 50 years. We see the employees and we think that we know how to manage employees. Actually, they forgot that they can't, because maybe I can manage 20 employees, not 10,000 employees, not 50,000 employees, not in different regions, right? So the problem was there. And it was huge. The pandemic actually forced everyone to recognize that the problem is here and you must solve it. You can't do the same thing. So basically, I think that the answer is COVID accelerated what already started as a phenomena, but it would have taken like 4 or 5 years instead of 4 or 5 weeks.
Thanks, Gal. Can I pick up on one aspect of COVID-19, which has really been to the fore in organisations in which I'm involved, and that is the whole area of mental health. And Ron, could I come in with you to start with, but then I'll also ask Gal in particular if they've picked anything up. But of course, your product and services covers mental health. What have you seen over the last 6 months? What's it mean?
So I'll start. So thanks for that, Kathryn. I'll start by saying that the whole telehealth, or being our own clinic, right? Being the telehealth provider of our virtual reality technology, has actually just started in February. That's when Corona was still a beer, right? It wasn't anything else, and that was actually very much fast-tracked. Then the adoption of telehealth in general, but also the services that we do because of Corona. The mental health side of things, we're just in the process of introducing in Australia. Okay, so I can't say we saw any impact. What I can say is that we're seeing a lot of interest, demand, and that's why we're fast tracking our mental health capabilities here. In the USA, they're already providing, especially around, stress-related, mental health symptoms, where Corona has actually amplified the number of individuals that require mental health, and a lot of the coping mechanisms that traditionally as human beings we use have been stripped away because of Corona, especially around socialization, isolation. That's a very powerful coping mechanism, and yeah, telehealth in general for mental health is on the rise, and specifically the virtual reality, you can do very interesting things that we're in the process of introducing here.
I think we will watch this space with real interest, Ron, because it's such a big issue for organisations now. Carl, do you want to comment on the area of mental health at all?
No, not as a doctor, right? But I think that we start to see more and more importance to the team in mental health, because you're isolated. And then I could give an example when we, even as a small company, right? When COVID started in March, or actually, came to the workplace in March, we started to do huddle ups. So every morning, for example, the management team gather for 10-15 minutes, and the customer success team, and then after a few weeks, it became like three times a week. It helped us to do both kind of a check-in, mental check-in. How do you feel? Where do you, also, what's your workplace? Someone with 4 kids in the living room is unlike me, that I have a room with almost private gym, and a balcony and so on. We're not the same, and once you understand that, you will treat differently to people that are ashamed of being a mother with 4 kids that are shouting all the day, and she still needs to serve customers and so on. It's very hard. I see it with my direct reporters, with my wife. For me, it's easy, right? But there are many people that it's so hard for them, and the stress comes from different angles. So the team, the close team, needs to work together, and need to understand each other, and need to communicate, and to create this type of interactions. And first recommendation that I gave to everyone: open your videos and dress up.
So Kathryn, I can add a little bit to that, because what the data told us when we, especially during March to June period, we were able to analyze what people were doing activity-wise on the desktops, right? And what we found in the first initial wave was, on average, people were spending 8.2 hours in front of their machines. And the immediate reaction was everybody celebrated. Why? Because productivity didn't suffer. But very quickly, what we realized was that if we didn't build intervention events across the day, our employees, or our users, or our customers' employees were going to hit a wall, and that was going to be far more detrimental to overall productivity. So what we did 2 things. First, we were able to segment data by department, so you could then figure out if you had challenges across the organization or via a department. That was the first thing. The second thing that we did was then we built intervention events, which were very simple pop-ups that appeared on your screen to say, hey, you seem to be working a lot now. Why not get up and stretch for the next 5 minutes? Or just at lunchtime, have a trigger, hey, it's lunch. Why don't you go have lunch right now? And what we then saw was a very different type of behavior within the organization. So let the data present the challenge. Think about how you use the technology to solve it. And that's what we've been seeing, and that's what we've been trying to help customers with.
Thanks, Raj. Raj, I'm actually interested. You started telling your company story by your founder helping his mum. And so I'm really interested in how different generations, so particularly millennials, do they engage with a different way, and where does that lead you to?
So not all millennials are equal. That's the first thing I'll tell you. They're not the same. What we have seen is the expectation is different. So the data that we have suggests that people in my demographic are typically up early in the morning, engaging with technology because they believe the rest of the day is meant doing proper work, which is talking to people, customers, etc. What we found was with the millennials, they prefer to engage with technology, especially corporate technology, internal applications at night. And the big challenge around that happening is that you have to rethink self-service, you have to rethink support. Because if they don't know how to do something and they can't resolve it, you don't have those support mechanisms available on demand 365. And so organizations are now shifting to rethink how they can create a 24/7 support mechanism, be it for millennials, be it for the other generations, because if you're a global organization, you'll have some millennials who are based in North America, some in Australia, some in Japan, some in Israel, and all of a sudden 24/7 changes. But they're looking to be proactively engaged, not waiting for, you can't wait for them to come. They're demanding a consumer experience, and they're expecting for immediate gratification. That's what we're seeing.
Very good. Now, a couple of last questions I think are coming in, but if anyone does want to ask any more, please do jump on. One of the questions, and I'm going to come to you, Ron, and you might have already picked this up. Now, I have to say, these are all about the role of privacy and independence, I think. So a question in terms, for you first, Ron, the questions come in, how do organisations work, given your technology and what it can tell you, with people who aren't complying? How do you manage that so it's effective and it's going to be accepted in the workplace? And I'm going to say particularly in, say, the Australian workplace.
All right, look, that's an interesting one, right? We, you know, if you're talking about like a non-conformist type of a team member, you know your employees, right? We cannot enforce users to put the headset on, okay? Yeah. So, by the way, some individuals that are maybe a bit different might actually find it more attractive than other people. So you never know. But at the end of the day, our tools allow you know, the corporate, the HR function to understand that a certain individual is not compliant. We are not the entity that is going to make him into a compliant person. Now, having said that, we do have a customer success team, and we do have our clinicians, and we also have visibility into non-compliant patients, and we actually have processes in place to work with our clinicians and to communicate with the patient to see why he's not engaged, why he's not following through with the care plan, because for us it's all about the patient outcome, right? So we have ways of interaction and trying to have active engagement with the patient to increase the engagement. That at the end of the day, if that individual says, look, I just don't want to do it, that's we can't enforce that.
Great. Well, given that we're coming up close to the hour, I just want to ask a broad question to each of you, and maybe starting with Gal. But given we've got a lot of people on the webinar who work with big corporates, so what are you finding is of most interest to big corporates, and any surprises there? And I'll come to Raj and Ron with that same question, just so that we wrap up.
Yeah, so big corporates actually are experiencing different pandemics. You know, like Australia today and Australia 3 weeks ago, Israel today, Israel 3 weeks ago, US today, US 3 weeks ago are different. So if you have employees in these 3 locations, you have at least 3 situations, and it will change in a week. So you need to be flexible. You need to understand that whatever decisions that you took yesterday are not relevant. So you need to take more flexible decisions, like playbooks and so on. And again, AI is here to help, because once you train the machine learning or the AI with the triggers, the next best action, and so on, you are able then to personalize based on the fact that you work from home, I work from the office, and so on.
Thanks, Gal. I'm coming across to you, Raj. What are you finding working with large companies? And I'll pick up on one of the tricky questions that was asked earlier of just about managing people's, so it's not Big Brother. How do you deal with that? Because that must be a big concern when you're talking with big corporates.
It's a question that is raised by all companies. And let me handle that question first. So first of all, what we are really doing is watching activity and behavior so we can find the friction points. We're not collecting any PII. A customer can decide to switch on or switch off depending on what they're really trying to do, because the ultimate goal is really trying to figure out how we can make that user or that employee's journey a far more palatable or enjoyable one. And the only way to do that is understand where the friction is. What we've seen between the different segments, if you think about large corporate, enterprise, small, medium business over this period of time, we've seen the top end and the bottom end of town respond far more aggressively, with far more agility, because they've realized they need to move and they need to react. The smaller organizations have known that they needed to do something quicker. If not, it's just for survival. And the larger organizations have seen an opportunity. Where we've seen things slow down is really in the enterprise space, where people are hamstrung a little bit by, what do I do next? I've got all these layers of bureaucracy to get something through the door. And so when we start looking with organizations, it's those who basically have an innovative mindset, who are really thinking about agility at the center of customer, who are really accelerating through the door.
Thanks, Raj. Ron, can I just touch base with you? You've obviously got the relationship with Bupa. What are you finding you're doing, the big learning with other corporates?
So I think the main thing we're seeing, and like Raj said, it's not just big corporates. So we see it across the entire, small to big companies. A lot of things have changed because of Corona, and we're not sure when they're going to change back. What's the new normal, maybe, if they're going to change back. And we see concerns around dispersed employees. That's where, so they're not, you don't see them in the corridor, you don't meet them in the water fountain, right? You just meet them like this in a Zoom session, if they even turn on their camera. And therefore, a lot of existing structures, mechanisms, programs that are in place around, well-being of employees, mental health well-being and other well-being are no longer relevant, and organizations need to kind of invent themselves, or the HR functions need to look at new ways to not just engage, but also to be satisfied that everything is okay. And it's not always the case. Therefore, I'm a big believer that, telehealth on all its shades and colors and aspects is, it's not I'm not quoting a term, but people are saying it, that the genie is out of the box, it's not coming back. And telehealth is here to stay, and organizations need to apply new tools for this new reality to make sure that their cohort of employees is well taken care of, because at the end of the day, it also translates into productivity. So that's what we're seeing across all organizations that we work with.
Thanks a lot, Ron. And I'm sure people are aware that we've just clicked over the hour. So I'm actually going to take the opportunity to hand back to Rachel now.
Thanks very much, Kathryn. And a big thank you to our speakers for joining us today from Tel Aviv, Melbourne, Singapore. It really is a global event, so we thank you for your time. We've had a couple of questions about follow-up information, so we will be sending an email shortly with company information, contact details, and presentations. I want to thank Kathryn for expertly moderating this very important discussion. And a huge thank you to all of you for joining us today. HR is a very important topic across all organizations. We're hoping to organize another webinar on this topic. And if there are any particular themes or domains that you think would be interesting to you or to your colleagues across the industry, please feel free to reach out. We're very much open to your ideas. So thank you all for joining us today, and hopefully we will see you again shortly, either virtually or maybe even in person. So thank you to everyone.